At least once in your life, you probably will experience some sort of low back pain, and that can be caused by gradual deconditioning of the lower back due to our modern sedentary lifestyle, such as sitting at a desk for long periods of time or bending and lifting in a wrong manner that can cause unnecessary stress and strain in the lower back. From hours to years of not stimulating or exercising the core muscles, the lower back muscles, or mobilizing the lower back to protect the lower back. And if we decide to do something out of the ordinary, for example, jumping on the trampoline or doing a sport we don't usually do, help someone move house or renovate a house, we're at risk of injury, not just your lower back, but other areas of the back as well. So I recommend doing some sort of core exercise, lower back exercise, or mobilize the lower back at least a few times a week to prevent lower back injury, lower back pain, and improve your lifestyle and improve your health of your spine. In this video, I'll be showing you the lower back exercises, the core exercises, and some mobilization exercises for your lower back inspired by Stuart McGill. If you're getting out of the pain phase for your lower back, I highly recommend you do these exercises to help you reduce the pain, prevent the pain, and prevent injury. I do these exercises myself to help my Olympic weightlifting because it helps my balance and it helps me keep that rigidity when I do that lifting and movement. I do prescribe these exercises to my patients as well, and they've definitely been improving and their lower back pain is subsided. I hope these exercises help you as much as they helped me and my patients.
Unilateral core exercises. Lay on the floor. Your back will naturally create an arch off the floor. Rotate your pelvis back into posterior pelvic tilt and your back will flatten. If you can slide your hands under your lower back, that means your lower back is not flat and the core is not activated. Now with your back flat against the floor, one leg is straight and lifted off the floor, and the other is bent with the foot on the floor for stability, raise your shoulders and head slightly off the floor. This counts as one repetition. Do this for 10 to 20 repetitions, having 1 minute rest, and repeat it for 4 sets. Remember to swap sides with one leg bent and the other leg straight each time. If you find these exercises uncomfortable, you can try to do modified isometric versions of this exercise by holding the position instead. However, it is crucial that the form is in a perfect position, such as keeping the pelvis rotated posteriorly, back flat, and the core is activated. Hold this position for 10 to 20 seconds and do them for 4 to 6 sets. Make sure you alternate both sides with the bent leg. If you need, have 1 minute break in between each set. By having one leg on the floor and one leg straight, you are creating a torsion in the lower back. To improve the exercise and keep you in better form, you can place your fingers on your abdomen, slightly to the side from your belly button to make sure your abdomen is constantly activated. By having one leg up and the other leg down whilst doing this exercise, it will work on the stabilizing muscles of the core whilst you are moving and causing uneven forces trying to twist and shift the core and the lower back from the rigid position. Therefore, this exercise is excellent for sport, preventing lower back pain and improving rigidity in the lower spine, preventing potential injuries. Please try not to protrude your neck out like you're trying to touch the ceiling with your chin. What you want to do is to have your chin slightly tucked in and raise your back of your head off the floor and not lead with the chin up. If you lead with your chin up, however, this will be overactivating and tensing your upper trapezius muscle that can cause tightness and pain in the neck and possibly headaches. Side planks. Start off by laying on your side with both knees bent and your feet behind you. Prop yourself up on your elbow so that your forearm is flat on the ground. Now push your arm into the floor through your shoulder and squeezing your fist at the same time to activate and recruit all the muscles in your shoulder. Whilst trying to stay balanced, have your assisting hand on the side of your hip and then raise your hip off the ground in a controlled manner. Squeeze your glutes so that your hips are straight with your body, making your body like a plank. Do 10 to 20 repetitions and repeat the exercise 3 times on each side. You can have a minute rest between each set if you need to. If you find this exercise too easy, you can do this exercise with your legs straight and place the foot that is on top in front of you for balance. This will reduce the leverage you have over the exercise and make the exercise a lot harder to do. Remember to keep your hips in line with your body to replicate a side plank during the exercise. If you find these exercises too hard, you can hold a side plank instead, which is an isometric exercise. However, it is crucial during a side plank hold to focus on activating the core muscles whilst breathing. The same rules apply here when you are doing the exercise with repetitions. Make sure you press through your shoulder and make a fist to ensure there is muscle tension and muscle recruitment in the shoulder and upper back. Hold the plank for 10 seconds and repeat the exercise on both sides for 3 sets each side. If you need a rest, take a break for 1 minute between each set. Try to start out with your knees first, and then when it's too easy, go into a full plank with your legs out. This exercise works on the quadratus lumborum and the oblique muscles of your abdominal wall. These muscles are in charge of helping you twist, turn, and bending side to side. In this case, by holding this position, you are resisting your body from collapsing against gravity. I really like prescribing this exercise because I notice most of the exercises that we tend to do or prescribe are very front and back dominated, such as bending forward and back. However, within clinic practice, I notice most of my patients I see tend to have poor side strength and twisting, causing them to sustain an injury during these movements. During the dynamic movement of the side plank raises, the spine will flex left to right. This will open and close the vertebrae, allowing nutrients to flow in and out of the discs. This will help reduce stiffness, inflammation, and repair if there is an injury. That's why the side plank raises are very effective to improve spinal health and reduce pain and stiffness in the lower back. Try them out. Cat cows. Go on all fours with your hands and knees spaced out or slightly wider than your shoulder width, and your knees are about 90 degrees. Then round your back and flex all segments in your spine all the way up, and posteriorly rotate your hips back, tucking your hips backwards, squeezing the abdominal muscles and chest muscles to make yourself look like an angry cat. This will cause the spine to flex. To do a cow position, anteriorly rotate your hips, drop your stomach towards the floor, and squeeze your shoulder blades together. This will extend your upper back and lower back slightly. Take in a deep, long breath during a cow position, and exhale in a long and slow manner in the cat position. Do 10 repetitions for 3 to 4 sets. And if you really need to, have 1 minute break between the sets. This exercise will help you when you have extreme or acute lower back pain, as it helps mobilize the spine and back in a safe manner. The vertebral discs in the spine get a chance to have mobilization and drawing fluid into the disc back again to reduce stiffness and inflammation. If you spend a lot of time standing or sitting during the day, I highly recommend this exercise to help with pain, stiffness, and maintain a healthy posture for the spine. A research paper was published in 2018 on the McGill stabilization exercises and conventional physical therapy exercises on how they affect pain, functional disability, and range of motion in chronic low back pain. The results showed that both physical therapy and the McGill stabilization exercises provided a similar outcome. However, the McGill exercises gave a better results in patients for functional disability and pain. So just a friendly reminder, the stabilization exercises in this video are the McGill stabilization exercises. And the modified exercises where there is a lot of dynamic movement are similar to conventional physical therapy exercises. Both exercises seem to help with low back pain and functionality, but the McGill exercises do seem to have a better result for functional disability and pain. So whether you have low back pain or want to prevent low back pain or injury, I highly recommend these exercises in this video. Bird dogs. This is another exercise named after an animal. Go on all fours and with your knees and hands slightly spread out, shoulder width apart. Find your neutral spine and try to brace it and lock it in position. Once you feel like you can hold yourself in this position, bring your legs straight out behind you, but not too high, as it may twist your spine and cause unnecessary rotation in your lower back. Then bring your opposite arm straight out in front of you with your elbows locked with your thumb up. This will help activate the lower trapezius muscle that tends to be neglected during the day through daily habits. Once you feel the lower trapezius muscle activate, you can tuck your thumb back in and clench your fist, and keep your arms straight out with your elbows locked. This will activate the muscles in the shoulders and the back much better. Now, in a slow and controlled manner, bring the knee of the extended leg that is out back in so it touches your fist, and then bring it back out again whilst you hold your core in place in a neutral spine. Do 10 repetitions on both sides for 2 to 3 sets on both sides with 1 minute rest. If you find this exercise too hard, you can do the isometric hold version of this exercise instead, where you just bring your leg out and your arm out and hold in the core and lower back in a neutral position. Hold this position for 10 seconds on both sides for 3 sets on each side. Rest 1 minute if you need to. People that mainly benefit from these exercises are people that rely on strong control of the core and lower back during movements of flexion where the spine is under pressure, such as powerlifters, Olympic weightlifters, or people that have gone through spinal surgery or injuries. I do them myself and prescribe these exercises for my patients, and I find that the ones that do learn and attain the strength over time seem to have less or no back pain at all in the long run. If you prefer to do the isometric holds but would like to challenge yourself a little bit further, you can by drawing small squares with either your fist or foot. This will create movement in the spine that the core will need to resist and work against to build core stability and control. This will be replicating external forces acting on you whilst you are bending over or trying to lift yourself or performing a lift in the gym. So the strength that you attain through these exercises are quite functional from daily activities and sport. Depending on how fast you draw the squares, you can try to draw 3 to 5 squares on both sides and do 3 sets on both sides with 1 minute break if you need to. Remember, you don't have to draw the squares clockwise, you can also draw the squares anti-clockwise. Obviously, work on your weaknesses so you can prevent the injury and lower back pain. So this is the exercise summary I've written for the video. Just pick 2 to 3 exercises you're comfortable with and do it for about 3 to 5 weeks. Once you're ready, just increase the intensity by doing more repetitions to a maximum of 20, or hold the exercise for a bit longer to a maximum of 20 seconds. And then repeat the program again. Feel free to pause the video and print screen this or download it from my link down below in the description box.
Once again, thanks for watching. I really want you to join my Facebook group. I want to build a community there where we can talk about all things health. Now, if you can't wait for the answers to your questions, please join my Patreon. That way you'll be supporting me and this channel. I'll put a link in the description box below. If you do have extreme low back pain, please check out my exercises for extreme low back pain video. Or if you prefer more core exercises, please check out my 6 best exercises for your core video. That video will definitely help you strengthen your core and help prevent you from low back pain. Remember, support my channel, hit like, hit subscribe, comment below if you have any questions, and I'll see you guys in the next one.